Welcome to a special episode of Highway to Health. This podcast was started to celebrate those that are committed to improving access, experience, and outcomes for patient and provider communities. My name is Nick Tombrella. I'm the Senior Vice President of Sales for Water Labs AI. We're excited to be joined today by our CEO and founder, Kamal Raj, and Laura Lee Tanner, who serves as an advisory board member to Water Labs. Welcome to both of you guys.
Thank you.
Thank you, Nick.
So just to get things started, we'll keep things very conversational today, but wanted to ask you guys a series of questions about AI and its impact on healthcare and the revenue cycle industry. So to start things off, revenue cycle is such a competitive space. What makes Water Labs AI different?
I will start with telling about why we started Water Labs, Nick. So Water Labs' vision is to address a specific gap which is existing in the industry for a long time now. If you look at my background, I come with 2+ decades of experience working as a tech head for the RCM community. With a lot of knowledge coming in from several organizations where I worked, we have been searching for answers to address specific needs on automation and AI, which was non-existent. There were generic components from several players out there, which I've been buying as head of technology, the licenses, and trying to use it for my organization, but really didn't serve the purpose, what we wanted as outcome. So when I started Water Labs AI, the specific vision is to address that gap, and our products are built around that. And today we have successful deployments for our clients, and it's been serving it well.
Awesome. And Laura Lee, obviously we're extremely excited to have you as a member of our advisory board. With your extensive experience, from your impression, what made Water Labs different in this space, and what kind of drew you to the partnership with us?
I think seeing true AI being deployed, so many companies out there are claiming to do AI and to use it. But really, it's RPA, it's robotic process automation. And I think RPA certainly serves a purpose, it has a place. But when I think of AI, I really think of the machine learning, taking in data and identifying what can be. If you look at denials, for example, and you see all of the reasons, all the denial codes, the CARC and RARC codes of why claims are being denied, if you can take that and you can learn from it, and you can say, look, if I change this before I submit the claim, I can prevent a denial. That's where I really feel like the power of AI comes in. And I see that happening with Water Labs. Not just RPA or not just using people to do everything.
Mm-hmm.
I'm a firm believer that you should try to automate as much as you possibly can, really to have an efficient revenue cycle.
Absolutely. So let's talk about that a little bit, and let's start with AI. Obviously, it's in our company name, but everybody out there is claiming to have AI. How can someone really differentiate between the companies that actually have AI and those that are claiming AI, but to your point, Laura Lee, masking it with just kind of surface level automation?
So if you look at a specific area, what Laura Lee was talking about, there are companies out there who are into traditional RCM services space. And while they're looking at automating and bringing in concepts for their clients and building solutions around it, AI is something, which is rarely used in the industry, especially in the RCM industries, because the access to data is not available with the service providers who are back offices. That is a major stopping factor for them to deploy anything. Water Labs AI solutions come with a workaround in this specific area, where our products are built around automation, where it can work without access to data. That makes it key for us to deliver solutions to our clients. So when everybody else now talks about AI being used for automation, like Laura Lee's pointed out, It's more of an RPA, which they're using licenses to automate specific portions of it, but that's not going to do any kind of end-to-end services with intelligence, which is the missing portion. So if you want your RPA to think and act like how humans are doing and complete specific tasks, that's where generative AI is to come into the picture. So to put that in place, we need to have technologies to work around the compliance which is there in this industry. And over the last 4 years, the products what we have built addresses that specific portion, because of which we have today the digital agents who can actually perform that task. This helps the existing employees who service that specific area to do tasks which are much better and more meaningful for them, where they leave the general day-to-day activities to be worked out by our AI-enabled RPA.
Awesome. So Laura Lee, from your perspective, I know you spent many years on the customer side of this industry, and you talked a lot about differentiating AI from surface level automation. So from a customer perspective, what would you be looking for to really determine whether someone has good technology on the AI front, or if, as you said, it's very surface level?
Well, first of all, I would ask a lot of questions. What are you automating?
Mm-hmm.
And, I think back to early in my career, very early in my career, I was training transcriptionists on a technology, a software, and we used a lot of macros. If you remember macros in the day, to me, RPA is a macro. You're going in, you're recording something, you're essentially replicating it. There's not really thinking,
mm-hmm.
right? But you think about some of the AI like ChatGPT that's out there. You plug in a paragraph and it's going to think and process and spit out something that's slightly new, right? So that, to me, that's the differentiator. Are you just replicating? It's probably RPA.
Mm-hmm.
If you're putting something and you're taking in data, you're churning that and you're creating something new, that's likely AI. But I would ask all those questions. Are you, and I go back to my example of denials, are you taking in data? Are you looking at, how something, performed and trying to prevent that going forward? To me, that's thinking. That's more of AI. So those are the things I'd look for.
Absolutely. And, you talked about automating processes that you can and using AI to do so. So I'd love to get both of your inputs on, what are the challenges right now in revenue cycle that are really leaning into automation and AI? Where are we seeing the most need for automation in terms of processes?
I would say the most important place where we need automation today is on the AR side and the accounts receivable, because that's where we have major challenges now with the number of AR days increasing, and we have lesser payments or delayed payments coming in from the payers. That actually impacts the cash flow of the hospitals and the practices. So that's actually the area where we need a lot of automation AI to kick in to help the cash flow better.
I would agree with that. I also think coding is, I think, a huge area. We still have a shortage of coders out there. There are a number of companies that are really trying to get into autonomous coding. And how can we automate that process, so we don't have to worry about the coding shortages? I think that's a huge area that AI can really benefit.
Yeah, absolutely. So I know we've talked a lot about RPA and AI, and I think we've dove into the differences, but obviously knowing they both have a place in the revenue cycle space, how do you really hone in on when to use which technology?
I think when you talk about AI, the one place where you can use AI specifically is on the coding. It's because that's a space where people use a lot of intelligence to assess and assign a code to a specific procedure or process there. So that's one area there is a real need for Gen AI to be used. And our product, QueryCode, is the product which has Gen AI specifically for coding. We actually try to automate multi-speciality using a product. Today we have several variants of this product deployed for our clients, from basic code book, which just helps them out to code much faster with better quality for the existing coders, as well as we have Gen AI enabled coding automation tools around it.
And I think when it comes to RPA, again, I think about those standard repeatable practices, things like payment posting, for example. Right. To me, that's a great use of an RPA. It's something that, once you see what 1, 2, 3, 4 steps need to be taken, then you can deploy RPA to record that and to replicate it. When I was running operations, for a different company, I walked in one day and I saw that we had coders on the phone calling an IVR to check claim status. That's a really expensive resource to be on the phone going through an IVR. So expensive resource, essentially talking to a bot. We can automate that with RPA.
Absolutely.
So, and that's what we did. Now, our challenge with RPA was that the payer consistently changed the script. And so I think it's also important to know that with RPA or AI, you can't just, it's not just one and done. You can't just do it and walk away, because there are other players that are in play here. So we had to have people that would monitor those exceptions. But that RPA worked for a period of time until the payer changed, and then we monitored the exceptions and we changed the script. But it was something that was pretty standard. And so we had a bot talking to a bot instead of that expensive resource. The other thing that I think we don't talk about a lot in automation conversations is how it really benefits the people that you have. And I often talk about using people, allowing them to work at their level of licensure. If you have a coder that is highly skilled, highly educated, and you have them do mundane tasks like talk to a bot on an IVR, the engagement and the satisfaction of that employee is going to be very low. What I noticed was that when we were able to replace what they were doing with a bot and actually allowed them to perform at their level of licensure, they were so much happier and satisfied in their job. So, people sometimes worry about how will my people feel? Will they feel like we're replacing them with a bot? No, not necessarily. You're allowing them to work at the level that they were, that they set out to work at.
Yeah, absolutely. So I'm glad you brought that up. Kamal, I'd love to get your perspective on what Water Labs is doing in terms of automation surrounding claim statusing and denial management.
The claim statusing and denial management is one space, right? Water Labs addressed way back. That's one of our first products which we came out with. I would say, this has been a working product for us since pre-COVID days. While the product evolved into a much better one now, and with several API integrations with our client PM systems as well as our internal products within Water Labs AI. Today, we have about 3,600 payers connected live on EDIs. That is what we have today, and about 45 payers on these are an enhanced claim statusing. That means we get exactly the same data, what you will get going through the portal of the payer or calling the rep on the payer side. So this kind of information, enables our AI platform to make much more meaningful decisions. The queue is set up in such a way within our products where instantly information is available in a sub-second kind of speed to tons of claim statuses. And the AI engine automatically decides on which has to go to payment posting, and it directly gets posted in the client PM system. And only a specific set of denials which really needs human interaction or access comes back to the reps to work on our side. This gives us a lot of information and data around the denials itself. And over time, when the clients are onboarded into our platform, I would say in about 6 months, the denial rates come down so less, because it's always addressed on the basics. We go back and give information to our clients exactly why specific set of denials are happening, how it can be fixed, and so that cash can come in much earlier. So the corrections are made either internally by our other teams, or it's sent back to the client and they make the corrections in the front end itself. So these rejections don't come up at all.
That's great. So obviously, we live in a world in healthcare where compliance is the utmost concern. What are the concerns around integrating AI into healthcare and revenue cycle? And furthermore, what is Water Labs doing to address these concerns?
Yeah, the products what we have built so far, Nick, are all built around compliances. That's our key while developing products. That's the reason I keep telling, right? There are standard products in RPA available out there where these generic providers of RPA sell licenses. We can take and build solutions around it. But eventually, right, those products may not be ready to run around the compliances of your clients. So the products of Water Labs AI is built in-house with our own proprietary technology. So it's set in such a way that it can work around the compliances. Today we use high-end AI-enabled solutions like vision-based technology, where it exactly mimics a human to work around the client systems. We don't have access to any data, like I said earlier. So it doesn't fetch anything. We don't store any PHIs. So that enables us to be SOC 2 Type 2 compliant. We are also an ISO compliant organization. We are actually a specific compliant organization in ISO for handling PHIs and personally identifiable information. So all these compliance revolve around and get certified purely because we don't keep any patient information while we automate things. Without that, using only vision-based technologies, our GenAI process information in our RPA. So that helps us, to keep clients safe and the data safe.
That's great. So Laura Lee, from your time as a customer in the industry, when you're evaluating technology, obviously compliance is a major concern. What type of things would you look for in an evaluation, to satisfy your need for compliance?
I would look at a couple of things. Number one, what Kamal was just talking about in terms of how is the data handled, how's data stored. I mean, that's the most important. But also, access to data and access to certain areas of the organization where the people that are going to be doing work on my behalf, is that physical plant, is that secured? That's something that I've always looked at when outsourcing or using a partner. I think that's critical.
That's great. So lastly, just one last thing. If you were able to have our listeners walk away with one message, one understanding from our conversation today, what would you want that to be?
For me, I would say when partnering with Water Labs, you're truly working with an AI company, not just a company that provides staffing. And I think that's a huge differentiator in the industry right now.
I would say we are pioneers in this industry, automating solutions around revenue cycle management space. And we come with decades of experience there, specifically on technology around this space. So if a solution comes around and compliant environment, what we're offering today, either the clients operate on a Citrix environment or they operate on a VMware environment, or it could be a basic remote desktop. We have solutions around it, and working with us could be the most compliant way of operating automation. So that's what we have to offer.
That's awesome. Thank you guys both so much for your time today. Hope you guys enjoyed it as much as I did. And I think that's all we have.
All right. Thanks, Nick.
Thanks, Nick.